Welcome to an introduction to Medicare, and thank you for attending today's invaluable presentation. My name is Kim Anderson, and I'm a North Dakota licensed CPA. I am with the Rooted Planning Group. I will be your presenter today, and at the end of today's presentation, I will give you my contact information so that if you have additional questions or would like your own Medicare RoadMap, you may contact me directly. So let's get started. We have three basic goals for today's session. The first goal, we're going to give you a basic understanding of Medicare, understanding the difference between Part A and Part B, and the differences between a Medicare Advantage plan and original Medicare with a supplement. Number two, we'll teach you the 6 steps of Medicare and help you understand why taking each step in order is critical to avoiding costly, potentially permanent Medicare mistakes. And number 3, we'll provide you with an opportunity to get your own customized Medicare RoadMap. Let's get started by learning a bit more about what I like to call the Medicare situation. Each year in the United States, 3.6 million people turn 65 and become eligible for Medicare. 3.6 million people. This is a population greater than 27 states in our country. It's a population equal to the entire population of Greater Los Angeles, California. It's a lot of people. Unfortunately, when it comes to Medicare, more than half of these people are willing, with a big emphasis on willing, to admit that they don't understand Medicare at all, making it very likely that as they go along, they'll make some sort of Medicare mistake. And quite frankly, they're easy to make. Sadly, just one Medicare mistake can literally cost you thousands of dollars a year for the rest of your life, and can even keep you from getting needed healthcare services. But why is this happening? Well, as you may have already noticed, we're forcing people to become Medicare experts simply to enroll in the program. In fact, when you are about to turn 65, you should automatically receive a booklet in the mail from Medicare called Medicare and You. This brochure explains the Medicare enrollment process. Unfortunately, the current version of this booklet is about 120 pages in length and isn't even comprehensive. So, if a person decides, I don't want to do this on my own, or I can't do this on my own, where do they turn for help? Seriously, that's probably the biggest problem with Medicare today. Luckily, you're here, so pat yourself on the back. Today, we're going to ensure that you get Medicare enrollment guidance that is fast, simple, expert, and unbiased. With this information, you'll be able to make the best Medicare decisions for your unique needs and avoid costly Medicare mistakes. So let's get started by learning some Medicare basics. You've probably heard that Medicare has 4 parts: A, B, C, and D. However, we prefer not to teach it this way. In our experience, people have a tendency to treat this like a shopping list. I have to get a Part A, a Part B, a Part C, and a Part D. But that's just not true. Medicare is confusing. And Part C is not really a part. As I just said, technically, Medicare Part C is not a part. It's simply a repackaging of Parts A, B, and D. So instead, we prefer to teach that Medicare has 3 parts and 2 distinct paths, 2 unique ways to get these 3 parts. We'll talk about these paths in a minute, but first, let's review the 3 parts of Medicare. Medicare Part A is hospital insurance. This part of Medicare is premium-free for those who have paid Medicare taxes for 10 years, or for those who have a spouse that has paid. If you are ever hospitalized or in need of skilled nursing facilities or hospice services, but not assisted living facilities, This is the part of Medicare that will provide you with coverage. Medicare Part B is medical insurance. This part of Medicare has a monthly premium. In 2019, the monthly premium for those who are new to Medicare is $135.50 per month. This part of Medicare provides you with the services you'll need to get diagnosed and treat a medical condition. This part of Medicare is optional, but if you do not enroll in this coverage, you could face later enrollment penalties. Part D is prescription drug coverage. This is coverage provided and administered by private insurance companies, not the U.S. government. This coverage helps to cover the cost of prescription medications in a plan's formulary. A drug formulary is essentially a catalog of the medications that a plan will cover and how it covers them. It's important to note that a Part D plan helps to cover the cost of drugs, and in many cases, you will share in the cost of your prescription through deductibles, copays, and coinsurance. It's also important to know that Part D plans do not cover over-the-counter medications, vitamins, and supplements. Now that we've discussed the basic parts of Medicare, let's talk about the two distinct paths or types of Medicare coverage. Most people, when they turn 65, have two path options: Original Medicare or Medicare Advantage. Some people can have additional path options, such as retiree coverage or military coverage. But for today's session, we'll address these two main paths. First, let's talk about the path of Original Medicare. Original Medicare is administered by the U.S. government. That's why we've placed the Capitol building in the background. Technically, the U.S. government is in charge. When you choose this path, you can see any provider who accepts Medicare, regardless of their location. Essentially, there are no networks. This means you can see providers while on vacation in sunny California or skiing the slopes of Colorado and receive the same coverage as you would if you were at home. This path always starts with the person signing up for both Parts A and Part B. Technically, you could stop right here and say, I'm enrolled in Medicare. Yes, technically that's true. However, by themselves, Parts A and B can become very expensive. In fact, Part A has a $1,400 deductible essentially every time you are hospitalized. Part B has a 20% coinsurance every time you see a doctor, every time you see a specialist, and every time you have an outpatient procedure. And Parts A and B have no maximum out-of-pocket limit, no cap in spending. That's why, for comprehensive coverage on this path, you also need to add a Medigap policy and a Part D prescription drug plan. A Medigap policy is the same thing as a Medicare supplement policy. And both a Medigap policy and a Part D drug plan are insurance provided by private insurance companies. Once you've paid the monthly premium for a Medigap plan, most, if not all, of those out-of-pocket costs associated with Parts A and Part B can, poof, simply go away. Let's learn a bit more about what a Medigap policy is. Medigap policies are the same thing as Medicare supplements. It is coverage provided by a private insurance company. These policies cover those things that Medicare Parts A and B do not cover, such as the $1,400 hospitalization deductible or the 20% coinsurance for healthcare services. With this coverage, you essentially pay one monthly premium, but then have very few, if any, out-of-pocket costs. With a Medigap policy, you essentially don't need to worry about Medicare Part A and Part B out-of-pocket spending limit because you essentially do not have out-of-pocket costs with this coverage. Medigap policies have been standardized by the federal government into 10 different plans, known by their letters, such as Plan C or Plan F. Regardless of the insurance provider or the premium you pay for this coverage, each plan must provide the same basic benefits. So for example, the Plan C you get from Mutual of Omaha will cover the exact same thing as the Plan C you get from Humana. This is the chart of federal standardization of Medigap plans. Some of the things you'll notice are the only difference between Plan F and Plan G is whether or not you want coverage of the Part B annual deductible, a $185 deductible in 2019. For this reason, you want to make sure that you do not pay more than $185 for this coverage. But studies show Plan F's average about $350 more nationwide than Plan G. As of 2020, newly eligible Medicare beneficiaries will no longer be able to purchase coverage of the Part B annual deductible. So Plan C and Plan F will essentially go away, but those with these plans before 2020 will be grandfathered in. Only Plans F and G cover excess charges up to the 20% additional cost that certain Medicare providers, usually specialists, can charge patients beyond the Medicare approved amounts. If you see a number of specialists, this can be very handy coverage to have, unless you live in states that do not allow excess coverage. If you want to travel outside of the US, consider getting a Medigap policy that includes foreign travel emergency coverage. Medicare does not cover foreign travel by itself. In order to get a Medigap policy with no questions asked, you must have a guaranteed issue right. So what is a guaranteed issue right? This is a rule that essentially ensures you can get a Medigap policy with no medical questions asked. When you have a guaranteed issue right, insurance companies cannot deny you a policy or raise rates based upon your medical history. You have a guaranteed issue right to get a Medigap policy for the first 6 months that you are 65 years or older and are enrolled in Medicare Part B for the first time. Once these things are true, essentially a clock starts ticking until the expiration of your guaranteed issue right. After you lose your guaranteed issue right, insurance companies can put you through underwriting, which means they can ask you medical questions and make you give a blood sample. If they find anything they do not like, they can deny you coverage. In other words, you may not be able to get a Medigap coverage again in your lifetime. 4 states, including New York, Connecticut, Massachusetts, and Maine, give you the ability to still get a Medigap policy with no questions asked outside of the standard guaranteed issue right. Now, let's take a closer look at the costs associated with the path of original Medicare. Part A is premium free for those who have paid 40 plus quarters or 10 years of Medicare taxes. Everyone enrolled in Part B, regardless of whether they choose original Medicare or a Medicare Advantage plan, pays the Part B premium. Those enrolling in Medicare in 2019 will pay $135.50 per month. The price of a Medigap policy varies by company, zip code, age, type of plan, etc. But the national average plan premium is around $180 per month. Without a Medigap policy in place, the out-of-pocket costs of Part A and B alone could become burdensome, if not catastrophic. A standalone Part D drug plan begins at about $15 per month and goes up from there. Now let's talk about the other path of Medicare, known as Medicare Advantage. First, you'll notice that there is no U.S. Capitol building in the background. Instead, we put a corporate building. This is because when you choose this path, Medicare Advantage is administered by private insurance companies. On this path, the insurance company is in charge and they get to make the rules. And when you visit the doctor, you'll show your insurance card, not your Medicare card. On this path, Medicare Advantage plans must provide basic Part A and Part B services, but they can change the rules that you must follow in order to get these services. More on that in just a minute. Plans on this path usually include Part D drug coverage as well. Then to make this path as attractive as possible, the plans available usually have very low or no monthly premiums. Plus, they sometimes add elements of dental, vision, and hearing coverage that original Medicare typically does not cover. Now, the insurance company essentially takes all of these ingredients of coverage and puts them into a blender to create a new type of Medicare coverage, known as a MAPD plan, or a Medicare Advantage with Part D drug coverage. This is what Medicare refers to as Part C. And as you can see, this is much more of a path than a part. Now remember, on the path of Medicare Advantage, you must follow the rules of the insurance company. Here are some of the most critical rules. You must see providers in network. If you go outside of the network, you may not have any coverage. As a result, you may have to pay your own medical bills out of your own pocket. If you have a plan with out-of-network coverage, you'll likely pay more for services, 50% of a doctor's visit or hospital stay. And it's important to remember that legally, these provider networks can change at any time. With Medicare Advantage plans, you are subject to prior authorization. This means that your doctor may say you need surgery, but before you can get that surgery, you have to get the insurance company to agree that you need the surgery and they are willing to pay for it. Prior authorization typically comes into play for services like home care, surgery, physical therapy, and seeing specialists. And each time you use healthcare services with a Medicare Advantage plan, you'll be responsible for paying any deductibles, co-payments, and co-insurance up to the national maximum out-of-pocket limit, which can change each year. Now, let's take a look at the costs on the path of Medicare Advantage. Once again, if you or your spouse have paid 40 plus quarters or 10 years of Medicare taxes, you'll receive Part A for free. And yes, you still pay for Medicare Part B on the path of Medicare Advantage. Now, this is where the big cost difference comes in. While you would pay about $180 per month for a Medicare supplement plan and about $30 for a Part D plan, your premiums for an MAPD plan can start with $0 and go up from there. But keep in mind that whenever you use healthcare services on the path of Medicare Advantage, you'll be responsible for paying any deductibles, co-pays, and co-insurance up to the plan's annual maximum out-of-pocket spending limit. And any services that are out of network or that you cannot get prior authorization for can be entirely your cost. Now, let's talk about why your initial enrollment path decision is so important. In 46 states, and as soon as you make your path decision and begin to head in that direction, you basically have to imagine that an earthquake happens behind you. And if you want to change paths or the types of coverage you have to wait for a bridge. But bridges only show up at certain times of the year, and in order to cross, you have to follow the rules of the bridge. It's actually pretty easy to switch from original Medicare to the path of Medicare Advantage. As long as you're doing it at the right time of the year, Medicare Advantage plans have to take you regardless of any pre-existing medical conditions. The problem is if you want to switch from Medicare Advantage back to original Medicare. In most cases, you no longer have your guaranteed issue right, your guaranteed ability to get a Medigap plan. This means that if you'd like to switch paths, the insurance companies that provide Medigap plans can make you submit your medical records and give a blood sample. If they find anything they do not like, they can charge you more for coverage or deny you a plan altogether. Without a Medigap policy, you're once again subject to all of the deductibles, co-pays, and co-insurance inherent in Part A and B with no spending limit. So this is why we say people can get stuck. because essentially if you cannot get a Medigap policy, there's really nothing better to switch to from a financial perspective. Now, are you ready for a twist? In the states of Connecticut, Massachusetts, Maine, and New York, the earthquake never happens. This means that at age 65, you can head in the direction of Medicare Advantage. If, heaven forbid, you're diagnosed with cancer at age 68, you could switch back to the path of original Medicare and still get a Medigap policy because you have a continuous guaranteed issue right in those 4 states. Some other states like California, Maine, Missouri, and Washington have more generous Medigap open enrollment rights, but nothing quite like those 4 states. But even in the states with a continuous guaranteed issue right, there are still a few important things to keep in mind. First, Medigap policy premiums in those states can be 20 to 200% higher than in other states. Second, you still only have the ability to change types of coverage during certain times of the year. If you live in California, Maine, Missouri, or Washington state, please contact me for Medicare nuances specific to your state. Now, let's get to the steps involved in the Medicare enrollment process. There are 6 of them. Step 1 is to check your timing. What I mean by this is it best for you to enroll in Medicare at age 65 during your initial enrollment period, or should you delay Medicare enrollment? Heaven forbid you delay when you should enroll, or you enroll when you should delay. Both can end up being very expensive, and long-term, if not permanent, Medicare mistakes could be made. For example, you may still be working and be eligible for employer-provided health care coverage. Someone may tell you, you don't need to enroll in Medicare right now. For some people, this may be good advice. However, for others, delaying Medicare could mean they won't have a primary payer or they won't be able to get a Medicare coverage when they want it. So it's very important to research the timing of your Medicare enrollment situation. The 3 most common Medicare enrollment periods are the initial enrollment period, a special enrollment period, and the general enrollment period. Your initial enrollment period is a 7-month window surrounding your birth month, beginning 3 months before your birth month, including your birth month, and the 3 months after your birth month. But if your birthday is on the first day of the month, everything shifts earlier by 1 month. So you have 4 months prior to your birth month, and then 2 months after your birth month. A special enrollment period is exactly that. A special period of Medicare enrollment for those who initially put off Medicare, most commonly because they were still working or had coverage through a spouse who was still working. You must qualify for this period. And the general enrollment period, which happens each year between January 1st and March 31st. This general enrollment period is for people who missed their initial enrollment period and do not qualify for a special enrollment period. If you enroll during the general enrollment period, Medicare coverage will not take effect until July 1st. Our case study for this step is a woman named Carol. Right before she turned 65, Carol is very fearful of incurring late enrollment penalties. So she went ahead and enrolled in Medicare Parts A, B, and D when she turned 65. But she also kept her husband's large employer group health plan with creditable drug coverage. Essentially what this means is that Carol enrolled unnecessarily in Parts B and D, paying almost $5,200 for duplicative coverage that she never used. And just so you know, with a large group employer health plan provided by a company with 20 or more employees that also has creditable drug coverage, a person can choose to delay Medicare enrollment without any late enrollment penalties. Carol should have either delayed enrolling in Medicare's Part A and B or given up her employer-provided coverage and fully enrolled in Medicare, including a supplement. So once you know the timing is right to enroll in Medicare, step 2 is choosing your Medicare path. By path, as we've already discussed, we mean type of coverage, original Medicare or Medicare Advantage. In this step, it's crucial that you understand the good, the bad, and the ugly about each type of coverage option you have and choose what's best for your unique needs. Your Medicare path choice could include original Medicare with a supplement or a Medicare Advantage plan. It could also be retiree coverage or military coverage. Please take the time to research all of your options and choose what's best for your unique situation, not your friends, not your agent, or even your spouse. With Medicare, there is no such thing as a family plan because each person must enroll individually, and there is no such thing as a perfect choice. Our case study for step 2 is a gentleman named Gary. Right before Gary turned 65, he saw a commercial for a Medicare Advantage plan. We've all seen them. It said $0 in monthly premiums, free dental coverage, free gym membership, sign up today. So Gary signed up. Unfortunately, that's all that Gary learned about this coverage before signing up. Gary has several chronic conditions. He is hospitalized 2 or 3 times a year. He sees specialists regularly and frequently has outpatient procedures. With his healthcare needs, Gary is now stuck, potentially for life, in a type of coverage in which he pays about $3,000 to $4,000 more per year and deals with network restrictions and prior authorizations requirement. And the prior authorization means that your doctor must get permission from the insurance company before you can have coverage for certain services, usually for surgeries, physical therapy, home health care, and specialists. If only Gary had taken the time to understand all of his coverage options and made a better decision for his unique needs. So the point is, take the time to learn about all of your options you have before making a decision. So once you know the timing and the type of coverage that's right for you, then you can begin choosing the specific plans that are best for you. United Healthcare versus Humana versus Blue Cross, Blue Shield, and the like. With the amount of marketing materials people who are about to turn 65 get, it's easy to believe that enrolling in Medicare is simply all about choosing a United Healthcare or Cigna plan. But choosing your specific plan is step 3, and as you've already seen, it's critical to do these steps in order. Please wait until step 3 to begin choosing specific plans. Now it's on to step 4, enrolling in Medicare. This is a step where you engage with the Social Security Administration to enroll in Medicare Part A and or Part B, whether through the Social Security website or at a local office. And then step 5, once you're enrolled in Part A and Part B of Medicare, you can then officially sign on the dotted line to enroll in the Part D, Medigap, or Medicare Advantage plan you chose in step 3. Finally is step 6. Many people think that after they enroll in Medicare, they're done. They can go ahead and put Medicare on autopilot. That is just not so. Year to year, Medicare Advantage plans and Part D drug plans can dramatically change their coverage. They can change provider networks, who's in and who's out. They can change drug formularies, which medications they cover, and how they cover them. They can change premiums, deductibles, co-pays, co-insurances, and out-of-pocket limits. If you are not watching how your coverage will change in the coming year and switching plans as needed, quite frankly, you're the one who's left paying the bill. In fact, studies show that people who don't review their plans overspend an average of $368 each year that they did not review their plans. So if it's been 4 years since you last reviewed your drug plan, chances are you're now overpaying by about $1,200 this year. In our case study for this step is a woman named Darella. Darella believed that open enrollment that during open enrollment, insurance companies and drug manufacturers were going to get about the same amount of money from her no matter what she did. So she believed it was best to keep the same coverage she's had for years and not waste time, in her words, messing around. So it was kind of a shock to her to find out that she could save more than $3,000 in the coming years simply by switching drug plans. She'd still receive the exact same medications, but with substantially less money coming out of her pocket. Dorella vowed to never skip an open enrollment period again. Now, when it comes to the 6 steps of Medicare enrollment, here's the sad thing. Most resources available today are designed to help with steps 3 through 6 of the Medicare enrollment process. But very few resources, other than self-study, really help with the regulatory and intensive steps of step 1, which is when to enroll, and step 2, how to choose between original Medicare with a supplement and Medicare Advantage. This is really unfortunate. Because it's in steps 1 and 2 where about 90% of the permanent and costly Medicare mistakes are made. And as we talked about before, Medicare mistakes are not to be taken lightly. In fact, just one Medicare mistake can cost a person thousands of dollars and often cannot be undone. So what are you supposed to do? Well, congratulations. You've already taken the first step toward getting the information you need to avoid costly mistakes by watching this presentation. Now that you have a basic understanding of Medicare and the steps to enrollment, I'm going to introduce you to a way to ensure that you're making decisions that are best for your unique needs, pertaining to step 1, which is when to enroll, and step 2, choosing between original Medicare and Medicare Advantage. By answering some simple questions, and these are questions you'll know the answer to, our Medicare RoadMap software gives you easy to understand guidance about the Medicare timing and coverage recommendations we believe are best for you. But we only make recommendations. You're always in the driver's seat. This individualized report details the information you need to smoothly enroll in Medicare, literally step by step. Your roadmap also provides you with specific initial enrollment period, and based upon when you take action, tells you when your Medicare coverage will begin. In addition to the step-by-step instructions, your roadmap serves as a lifetime document. You can print it, file it, and refer to it whenever you have a question about your Medicare situation. Information about open enrollment, how to set up a Part B Easy Pay account, how to get a replacement Medicare card, if you'll be subject to higher Medicare premiums, and the 4 Part D drug payment stages, including the notorious donut hole, plus much more is included in this roadmap. If you'd like your own customized Medicare roadmap, please set an appointment with me today. And if you'd like this presentation, please tell your friends about it. We also offer other presentations that may be of interest to you on retirement-related topics, such as Social Security, caregiving, and generational giving, just to name a few. To view these presentations, please visit our website at www.rootedpg.com.